heels of the Supreme Court debate this week over the new health care law, local leaders present their own arguments. Good evening, I'm Mark Allen.
And I'm Megan O'Rourke. The health care law was signed in March of 2010. Among many other things, it requires all Americans to have insurance by 2014, setting up special exchanges to provide coverage. It forbids insurance companies from dropping people when they get sick and setting lifetime caps. It also covers preventative services with little or no cost and allows young adults to stay on their parents' insurance until the age of 26. Alexa Ashwell spoke with people on both sides of the issue tonight. She's live with what they hope the Supreme Court will decide.
Well, the big decision is just 3 months away. Opposers hope the Supreme Court declares the law unconstitutional, but I spoke with a woman earlier tonight who says she wouldn't be here today if it weren't for the Affordable Care Act. Elizabeth Dyer stands before a campaign sign during a healthcare-related phone bank in support of a man she says saved her life and her family with the Affordable Care Act.
It would have bankrupted them, plus I'd be gone. My son would be without a mother, and my husband without a wife.
Dyer is a 4-time cancer survivor. The 57-year-old was diagnosed with lymphoma back in 2007, but because of the new law, the insurance company couldn't put a cap on how much it would spend for her care, something that was all too common a few years ago.
I wouldn't have gotten to see all the specialists I saw. I wouldn't have gotten all the treatment, 2 separate chemotherapies, one that lasted months and months. I wouldn't have gotten to be here now.
Dyer says the law also made a difference in her son's life, who suddenly fell ill at 24, an age where she believes he would have otherwise been uninsured if he was not able to remain on his father's plan.
He wouldn't have gotten that care, and if he had survived, he'd have $50,000 or $60,000 worth of bills. Those are the ones that we've gotten that, insurance is paying for most of it.
Dayton Tea Party founder and Affordable Care Act opposer Rob Scott empathizes with Dyer's battle with cancer, but says the notion of the federal government taking over the healthcare system is not the answer.
You could look at some things like intrastate health insurance plans, going across state lines, bringing more health plans into the free market so to drive down costs so that we can get more people insured.
Scott is confident the Supreme Court will strike down the bill.
The individual mandate itself is certainly, and they use the Commerce Clause to delve into our lives and to force us to buy certain health insurances, and as well as fining us for not buying certain health insurances.
Again, the Supreme Court will vote on the bill in June. Reporting in Dayton, Alexa Ashwell, 2 News.
New